Surgical hand scrubbing is a systematic washing of hands and forearms, and it is performed very thoroughly before conducting a surgery. The surgical hand scrubbing is performed in order to remove dirt and transient microorganisms from the nails, hands, and forearms. It also minimizes the resident microbial and inhibits rebound growth of microorganisms. Before doing the surgical scrubbing procedure, we must first remove our jewelries from both hands and arms. Inspect our skin and nails and ensure that our skin is free from any cuts. Nails must not extend past through our fingertips, and our nail polish must be removed or intact without chips or scratches. Put your own personal protective equipment and make sure that your hair and ear is tucked into your surgical head covering. Don proper eye protection and use surgical mask covering your nose, mouth, and if applicable, facial hair. To begin the scrubbing, tear open up a sponge of your preferred hospital group of antiseptic. It's either chlorhexidine or betadine. Place the open packet on the shelf above the sink with the tear facing the ceiling. Pre-wash your hands and arms only if this is the first case of the day and if the hands are visibly soiled. Use the soap from the dispenser located within the sink or in a separate container above the sink. Use the disposable nail pick to clean under your fingernails under running water, then dispose after use. Rinse hands and forearms. Once the hands and arms have been washed, remove the sterile surgical sponge from its wrapper. With fingertips together, use a light but firm pressure to stroke the nails in back and forth motion with the abrasive brush side of the sponge with 30 strokes. Place fingers side by side including the thumb, then scrub the surface of the palm with 10 strokes. Turn the hand over and scrub the dorsal surface with 10 strokes. Scrub the outside of the surface of the thumb from wrist to the tip of the thumb with 10 strokes. Continue to apply 10 strokes to the other side of thumb and to each side of your fingers. Once you scrub the area, do not go back again. After you scrub your hand, it's time to scrub your arm on the same side. Divide your arm into thirds, from wrist until 2 inches above the elbow. Apply 10 strokes to the top, bottom, and both sides of each section. Repeat the scrub on the other hand and arm. After it, discard the surgical sponge in the trash can beside the sink. Start rinsing, starting from the fingertips, then continue to the arm and elbow, moving in one forward direction to the water. Always keep your elbow at right angle and hand raised above the level of your elbow. Do not move arms back and forth in the water. Once rinsing is complete and no antiseptic remains on the hand and arms, turn off the water with the knee control. To avoid contamination, keep hands above the level of elbow away from the scrub attire and non-sterile surfaces. Allow residual water to drip off the elbows and into the sink. Do not shake or wave hands and arms to remove the excess water. Move backwards towards the operating room door and dry hands and arms with a sterile towel before donning a surgical gown and gloves.